What's up, friends? Welcome. It's time to elevate and thrive. And today I have a topic that you are going to love. If you're dealing with any kind of muscle soreness or muscle injury, or even chronic muscle pain, we have an exciting new therapy that we're going to share with you today. Welcome. I'm here with my co-host, Dr. Angela Yeagley.
Hello, everyone.
Welcome, welcome. So today we're going to talk about shockwave therapy.
Yes,
It has a cool name.
it's a great name. Yes, and a great therapy. Like, it's good. Goes
All
together.
around good.
Yeah.
Good name and good therapy. Sometimes cool therapies have dumb names. And sometimes, dumb therapies have cool names. And so they kind of get you excited, and then it's a big letdown.
It's good. It's good to talk about this.
It is. It totally is. But like shockwave is actually really cool. So let's talk a little bit about what shockwave is, and maybe we'll cover kind of how we use it, what a person can expect, maybe why they would care about shockwave.
Absolutely. So shockwave is the application. Basically, when you're coming in and looking at it, it's a machine, right? Where you're taking a particular instrument and placing it on the area that you're treating. And it delivers a shockwave, which is a burst, almost basically it's a sound wave, right? And so why that's important compared to, say, if somebody has a massage gun, right? They might think, oh, I have a muscle strain or a knot, or most people call them knots, right? It's like, oh, I have a restriction, or I can't move my arm or a certain area of their body as well as they normally would. They're like, oh, I'll just put the massage gun on it. So how this is different is that depending on the different tips that are used with it, it can actually deliver that sound wave deep into the tissue. So you can go quite deep with this to work on releasing the restriction, or we call it an adhesion or a trigger point or scar tissue, or basically bring in circulation to an area. So maybe I feel like I'm not describing it very well, but like maybe let's talk about treatments, because I think that might help for people to understand.
No, I think you're describing it well, but it's like, okay, that's all theoretical. I'm trying to understand what that's like.
Yes.
So we're going to deliver basically focused energy to a very targeted spot of the body, and it's going to kind of create some healing through increased blood flow or through breaking up of scar tissue, etc.
Exactly.
Yeah, so basically it's a sonic kind of therapy, energy therapy, right? That you can feel. You can definitely feel this.
Strong.
So it's not like a woo woo waving it's not like you're not holding up an Amazon Alexa speaker next to a sore muscle and you're like playing some Doobie Brothers, and it's like those guitar riffs are getting in there to the muscle. No, see, that can work into your soul.
Yeah.
That's how that music can penetrate real deep into the soul. But the shockwave is a sonic energy, but you can feel it. I mean, it's definitely strong.
It's a strong energy, absolutely. So for example, let's say somebody has a shoulder tendonitis, right? And we would be thinking of this, whether it's acute or it's chronic. And even if you're getting other types of therapies on it. So if you think of someone who's able, whenever we have an injury or we have inflammation, and the body, starts to try to mobilize resources to that area. And some of the things that it will do in response is will start to kind of calcify or scar up that area, which why this is important to treat it is because that tissue, if left alone, is actually weaker than the surrounding tissue.
Yeah, so like initially that's a good thing, right?
It's a great thing.
Stabilizing, right? Keeps it kind of restricting movement to enable healing, prevent further injury. But then you're saying the problem is if those adhesions and that scar tissue, that calcifications, if you don't do something with those, then you've actually now created a system long term that's weaker. That part of your body now is going to be weaker because that calcification, those adhesions aren't as strong as healthy tissue. Exactly.
Weaker and more restricted in its use, and possibly painful too. So say somebody has, again, an acute shoulder tendonitis, right? And that could be your whole rotator cuff. I mean, in several areas, could just be like a bicipital tendonitis. Or again, maybe you've had multiple injuries, so you've got that calcification from long term. And some people, when they move a joint, they can hear a crunching, it's like crunch, crunch, crunch. So what this will do is you can target typically people who work in this area in physical medicine, so like us, or say our, favorite colleagues at Head to Toe, or physical therapists or physical medicine doctors, like you can feel the restrictions and adhesions, right? So when you are touching an area, like a joint or an area of injury in the muscle, like most people, when you've been doing it long enough, you can feel the restrictions, and you can see that with, a restricted range of motion as well. And so say with this tendonitis, what we would do is, because the body, of course, is compensating a little bit to make up for that pain wherever that tendon is inflamed, right? So you're going to release all of those points around the shoulder to open it up, as well as you can treat the tendon itself. And what the cool thing is about the shockwave is that it will stimulate the growth of new blood flow, new blood vessels. And why that's important, say especially for like a ligament or a tendon, is that so like when we think about muscle, right? If you ever see it, like, steak, it's red, right? That's muscle. It has a lot of blood flow. If you see ligaments, that's the fascia, the stuff or things that you're pulling off the cow. Or if you've seen, examples of it, like a tendon or a ligament, it's white, right? There's no blood flow. I mean, it's very, very little blood flow. And that's why it takes so long for these things to heal. So when you are hitting it with that shockwave, and you are encouraging the actual growth of new blood vessels in that area, it's one of the things that's going to increase the healing time, right? And make everything go quicker and faster as far as your recovery. The other thing that it does is that it actually stimulates and attracts growth factors, basically, and stem cell activity in the area. So stem cells, as we know, can adapt to wherever they're at. So I think that's also really cool. The other part, this is in a study, looks at it actually cleans up cells as well that are injured or dying, right? Will help to kind of eliminate those, which again increases the, healthy tissue in the area. And then the last would be like breaking up that calcification. And I think it's something, besides that, like, or the scar tissue and the calcification that you experienced, or that we experienced in treatment of your injury. Right?
Oh yeah, absolutely. I mean, it does. So like, to summarize all that, it does a lot of cool stuff in terms of like, of like cellular repair, muscle repair, like mobility, restoring function and stuff. Yeah, absolutely. So for anyone who doesn't know, I partially tore my pec muscle. I don't know, it's probably like 6-8 weeks ago. And yeah, we've been using Shockwave as part of the treatment arsenal to help restore function and bring it back online. And I would absolutely say, we can feel the difference before and after when we're using the Shockwave on that area, that injured area. You could feel the decrease in the stiffness and the immobility of the muscle in the connected tendon as well. So it is definitely a very cool, powerful treatment.
Yeah, and it was immediate. Like, so it started out, it felt ropey, tight.
Yeah.
I could feel kind of that, you could feel the scar tissue kind of starting to lay down there, and definitely different than your other side, right? Like it's, yeah. And so the body, of course, is working on repairing, but after the shockwave, it was like fluid, soft, mobile, way less restriction. It was like, it felt so much like a much healthier tissue, right?
Yeah, it was definitely immediate. And it's one of those things too that, you accrue more benefit, over time, right? So it's typically not a one and done style treatment. You'd be using this a number of times, 3 to 6 times or more, depending on the area and whatnot. But that seems like, right, when we say about
6 is kind of the standard. Yeah, like once or twice a week for 6 treatments. A lot of the studies on muscle tears and strains and tendonitis, plantar fasciitis, are a minimum of 6 treatments. But of course, I mean, if yours is mild and then at 3, you're like, oh, I feel great and it's done. Well, then, okay. Yeah.
Be done at 3. Yeah. And you've experimented with it for some muscle tightness in your kind of back and neck that kind of sets you up for long-term kind of issues with headaches and stiff neck and that type of thing.
Yes, I have chronic a chronic neck rotation, and my muscles really don't like it, and so they will spasm and lock down, and I'll get little trigger points of those knots in the upper part of my head and neck, and yeah, like that area we have to be careful, right? Because it's tender, right on the neck and skull. So, using the smaller tick is a little bit nicer.
Yeah, so what's cool about the Shockwave device is that it comes with, had all these different heads, right? That attachments that allow the pressure and the shockwave to be moderated or changed depending on the body area and the treatment style. Some go deeper and harder, some are lighter, softer, more gentle. And there's a whole kind of treatment protocol for these different things where we change the frequency and the pressure of the device to really make sure that it's delivering the energy to the right spot to produce the healing that we want.
Exactly, yeah. And especially, say, for instance, if somebody is a smaller person, right, then maybe you would start on the lighter side of the recommended setting. If someone's larger and they have more muscle, right, maybe you go heavier or deeper.
Yep, deeper and dial it up a little bit.
Dial it up, to get a little stronger treatment. And it can be adjusted even during the treatment. Like, okay, we're going to start small. We're going to start lighter. Oh, you're doing great. Let's go a little, let's increase this intensity.
And it's pretty cool. This one, we were looking at some of the studies around this, and for one of the particular studies I remember chatting about before we jumped on the show dealt with a large number of athletes who had a variety of different muscle conditions, muscle tears, injuries, pull strains. And there was across the board, pretty much every single athlete saw improvement over time with the usage of this device. So it sped up their return to play and increased their healing factor quite significantly. So so it is a pretty legit treatment process and lots of great information out there on it.
Absolutely.
You can find some cool stuff even like on YouTube and various other stuff. It's been around for a little bit.
Yeah. The studies were really interesting and absolutely that, when they took the group of athletes, again, whether it was a tendonitis, a tear, mild tear, medium tear, like, that they all had a significant, improvement in their ability to return and play, like much quicker than kind of like the placebo group.
Totally.
Who did all of these athletes, actually, just to note, did all the standard PT, did all of the standard stuff that you would do in recovery. So they all did that. The only difference between the two groups was one got Shockwave and the other didn't. So I think that's really telling. Of course, whenever you're injured, you should do all the things. There's no reason not to make sure you're in alignment, to take advantage of all the other therapies, laser, doing your exercises, all of these things.
It's one of those things, why not? You do everything you can do to speed up that healing and really ensure that you're going to have a complete recovery and that you're going to have full use and full function of that particular area of your body when it's all said and done. So you should do all the stuff you can do. And you're generally, a lot of times with these types of injuries, you are working with a team of professionals on it. You might see a PT for a few different things, and then you might be seeing, say, like the team over at head to toe for another set of activities, exercises, treatments. And then you might come in here and we might be doing Shockwave on it, or PRP, or some of the other regenerative internal medicine techniques that we can use to help speed the process up.
Like the high-dose IV vitamin C.
Yep.
And the Beamer, right? Let's do all the things.
Do everything.
I do want to mention a couple of things that aren't quite necessarily related to joint pain, but plantar fasciitis, actually, there's a lot of, that's a difficult one to treat because it's such a thick tissue and people have a really hard time once that tissue is inflamed. Like getting it calmed down is really hard. And so Shockwave is actually performed really, really well. And it makes sense to me if you think about you're able to get like a deep penetration, improve that blood flow, improve that stem cell or growth factor activity for repair. So I'm really excited about that because that is actually a hard.
That is very hard to treat. Yeah, it is. From a manual therapy standpoint.
Absolutely. Hard to get deep.
Any of the tendon stuff is actually really, really tricky.
It is. Yeah.
And I've seen a lot of specialists for different tendon issues I've had before. Can get up some big flare up in my elbow tendon, kind of from tricep extensions and just like lifting weights basically, for the last 25 years. and that's hard to do. They can get in there and they can do some scraping.
Yeah.
They can do some tools like that. They can hit it with laser, but the shockwave can get in there and do a lot of work in those tendon areas, which are very hard to treat. So that would be a tennis elbow, plantar fasciitis, carpal tunnel. All of those type of things are incredibly Achilles. Yep.
Yeah. Well, the other thing too, also that it really stood out in the studies as well is low back pain. So again, if we think about in the back, we have these huge muscles, right? The lumbar paraspinals, and that's just kind of the name of the group of them. But they're large and they go deep, right? And so once those muscles become adhesed or restricted, and they're inflamed and in pain, it's hard to get deep into that tissue we'll do injections, things like that. But you have to do a deep injection to release those lumbar paraspinals, which we like doing. We can do that with the shockwave, but actually the shockwave also performed really, really well in studies on chronic low back pain. So I thought that was pretty cool because that's also like plantar fasciitis.
Hard to treat.
It's another hard to treat area. Yeah. And I think anybody who's experienced low back pain, say they're recovering from they blew a disc and all their muscles seized like around it, and because you're compensating. And you're not going to be operated. A lot of times they don't want to operate on those discs. Most surgeons won't, unless you're like, I'm going to kill you unless you, please, you better operate on this thing. Most surgeons won't do it. So you just have to work on healing your way around it, right? So it's a long process. So if that's happening to you, let's absolutely do some shockwave on it.
Totally.
Really good.
Yeah. So I mean, if you're thinking, I wonder how shockwave can help me, and you don't have an immediate, thing that comes into your head, you're probably good for now. But if you have chronic pain, right? If you have any of these, you have a tear or a strain, or you just have a chronic injury area where you're prone to inflammation and pain, and whether that could be a tendon or a muscle, or it's a particular activity or exercise that you do, this is absolutely a therapy we should explore, and something that you should think about on your next visit in and talk to us about it, because it can be a very, very powerful treatment that has really some pretty incredible results, and that can happen in a relatively short period of time.
Yeah, absolutely. Especially if you're able to come in a couple times.
Exactly. If you can come a couple times a week, I mean, you can get up through, 6 treatments pretty fast.
Yeah, absolutely. Yeah. So if you have questions about this, I would say please reach out to us. Come in. We'll happy to have you do an initial session and experience it, because most people are going to notice a difference. I mean, with one treatment, they're going to see a difference. Now, usually we want you to keep going. That's where the real healing is going to come. But come and try it.
Don't be. I think it's going to be a one and done type thing. I mean, I would be thinking 3 to 6. And we would package this in different bundles, and that has different pricing or whatever. So generally, we're going to recommend 6, but we could also test 3 in some cases as well.
Yeah, absolutely.
All right. Well, until the next time, thank you for being here. And if you want to book this or want to talk more about it, you can schedule online, shoot us an email, or give us a call here at the office, and we can get you in to talk about how Shockwave can help.
Sounds great.
Chat later.
Okay, bye.
Bye.